Tonight on KQED Newsroom, we're assessing the damage and lessons learned from January's epic storms and discussing Governor Newsom and President Biden's tour of rain-ravaged areas in the Golden State. Plus, San Francisco General Hospital is celebrating 150 years of serving our community. We speak with the hospital's leadership about this historic institution, its challenges, and what lies ahead. And we enjoy the artistry of hearts in San Francisco. Coming to you from KQED headquarters this Friday, January 20th, 2023. Hello and welcome to the show. I'm Priya David Clemens, and this is KQED Newsroom. We are done with the rain, it seems. After weeks of downpours, the skies have turned blue and the sun has been shining. The snowpack in the Sierra Nevada is high, at levels typically not seen until late April. It's double what it was at this time last year. The rain has gone a long way toward helping with drought conditions. There have been serious concerns, though, about how much of the water we were able to store versus how much ran off into the ocean. Joining us now are KQED editor and reporter Dan Brekke and KQED morning news anchor Brian Watt, who have both been covering the storms. Thank you so much for joining me here.
Hello.
Yeah. So, Brian, kick us off now that the storms have passed. Give us an overview of the damage here in California.
Well, at the last count, we know that these storms killed 21 people. That's at the last count. In terms of the overall cost to the state, estimates are already going over $1 billion, okay? 40 out of 58 counties in California were hit by these storms. And if you take one county that we've heard a lot about with the storms, it's Santa Cruz County. We talked to the finance director there. He said $15 million easily for roads and parks repair. That doesn't include damage to personal property and even the agricultural damage that comes in to the farms there. All
right. Well, yesterday, President Biden and Governor Newsom walked some of these damaged areas. Dan, tell us about the federal and state money that's coming in, how much that will help, how much counties are going to be out on their own to have to deal with this.
Well, the state stepped forward very early with a disaster declaration. And just this past week, the Biden administration approved a major disaster declaration. And that means the federal government will pick up about 70% of the public costs of this. So the counties ought to be in pretty good shape with that state and federal money.
All right. Well, there have been hundreds of thousands of people who have been impacted negatively by these storms, losing power, having their basements flooded. Brian, you had your basement filled with rainwater as well, right?
Yes, the old garage basement filled with rainwater. And let me just say, as someone who's relatively new to home ownership, if you've never seen your garage fill up with water, it is a shock. The learning curve is steep. You learn about sump pumps. You learn about shop vacs. You have to learn quickly. But I will say this, for all the time I spent out in the rain bailing water, my home never lost power. That happened to a lot of people, including our own Farida Jabala Romero here at KQED. She documented her story. And I spoke with a woman in Wallala who was without power for 9 days before it came back on. So this is happening. Then there are the people who lost their homes. They were displaced. I didn't have to leave my home. I had to keep bailing water out of it. But there was a building in East Oakland, an apartment building, where dozens of families just had to move out. They were flooded out of the structure and had to go to hotels and in some cases homeless shelters.
All right. I want to turn to this Cal Matters report that recently came out. This seems sort of troubling. It said that only a relatively tiny amount of the immense storm runoff has found its way into storage. Apparently, our environmental regulations protect a small fish in the delta called the smelt. And apparently, according to these environmental regulations, most of the water that comes in initially flushes out through our systems, in part to protect this. And, there have been a lot of Republican members of the state assembly who are making a big hue and cry over this, Dan, saying this water should have been captured. It should not have been allowed to just run off into the bay. This is not a new concern. When it rains heavily, this has been brought up before. Can you tell us a little bit about where we are for storage of all of this water?
Well, you're absolutely right. I mean, this is a very old cry when we have a wet winter. We're letting water waste to the sea. And the truth is, the way the system works is you can only ever capture a small percentage of what's coming down. We just don't have the kind of storage. Now, some people would say, well, let's build more. California is actually probably the most intensively plumbed area in the entire world in terms of the number of dams we have in place. And so there is lots of storage there. One of the problems with trying to capture water, though, is you do need a place to put it. And so that's what part of this debate is about right now. It's true that when this rain event and flood event began, there are rules in place to protect the Delta smelt. There's a 2-week period where basically the pumps in the Delta that send water to the south are running at a low rate, and most of the water is let go. That means less water going south to San Luis Reservoir, which is a big, important facility for farms and cities to the south of us. But the people who have really studied this intensively feel like you need more than just building more dams, both for the question of storage of water, but also for flood protection. So there's a lot of effort right now and a lot of thought about building areas in the San Joaquin Valley where you let floodwaters spread out and sink into the ground, into the aquifers that have been depleted during years of drought by overpumping of groundwater. So that would be one of the solutions that would protect a city like Stockton, for instance, or actually help protect it. You need more things. And over time, maybe develop better regulations, more refined regulations, to let more water go through at certain specific times so that you could get more water to the south.
How's our construction pipeline going for building these sorts of capture systems?
Well, as I said, we've built a lot of dams in the past. There is a reservoir planned for the west side of the Sacramento Valley, a place called Sites Reservoir in the hills. And it would be a large reservoir, about half the size of Lake Shasta, but it would be significant. Now, the problem with this is it's a very expensive project, and there are real questions about whether the water that could be captured in that facility would really be worth the money that would be spent. The other thing is that the state is, and the Newsom administration is really using this event now to sort of promote their idea for a Delta tunnel that they say would allow for more efficient flow of water through the Delta and capture of water.
Well, we did get to see some beautiful images of these reservoirs filling up over the last few weeks. Brian, walk us through where we're at right now.
Well, let's take a reservoir we know well in these parts, Lake Oroville. Last year, it was at 44% capacity, but in come all these atmospheric rivers and storms, and it's now at 58% capacity. So across the state, the 2022 water year ended at 69% of average capacity, and now we are at 98% of average for this time of year across the state. So yes, we did get a lot of good water.
And I want to add to that, we've got a huge snowpack. The snowpack is 245% of where it normally is at this time of year. In fact, we've got 25% more than we would usually see on April 1st, which is the peak of the snowpack season. And so that's our frozen reservoir, and that could be really good news for the year ahead.
That's great. I love that term, frozen reservoir. It's
Right.
a really artistic and beautiful term, right? Very hopeful for
Yes.
what we have coming forward. Dan, as we were mentioning, hundreds of thousands of people lost power. PG&E has said, obviously, that undergrounding all of those power lines is fiscally unfeasible. We cannot do that. What are they looking at doing to be more resilient in storms in the future?
Well, they're really put to the test in a system of storms like this that were not only wet, but very windy, most of them. A total of 2.6 million customers. Multiply that by about 3, so maybe 7 to 8 million people were in the dark for at least a short time during this storm event. So what they can do, look, the undergrounding project is really aimed at wildfire safety. It is expensive. The company says they're determined to figure out a way of making it cheaper, but there's a really determined effort on their part to see if they can work that out. What they can do and what people have wanted them to do, both ratepayers we customers who pay the bills and advocates, our ratepayer advocates have said for a long time is that they need to stay on top of maintenance everywhere in their system. So that means vegetation management, taking care of dangerous trees near their lines that don't start wildfires and also don't take them down during storms, and make sure that all of their equipment is safe as it needs to be.
So there was another problem that we saw, which was the amount of sewage that spilled into the San Francisco Bay. I mean, tens of millions of gallons of sewage. What happened here?
Enough sewage to fill 94 Olympic swimming pools is what we learned actually this week. And this is going into Bay Area waterways, also into streets and even into some yards. So this is a problem, and municipalities are looking at how to fix this, and it's really just a question of upgrading and updating pipes. There are a lot of old pipes, they need to be replaced, and this is a costly proposition. In the community of Castro Valley, 65,000 people, just that, it's a $500 million estimate to replace the sewage pipes.
In just one East Bay neighborhood.
Right, in just one East Bay neighborhood. Now, on a micro level and far more adorably, if you live in San Francisco, you can adopt a storm drain. And I'm happy to report that a few of my KQED News colleagues did just that. And so do your part.
There are great pictures of that on kqed.org and also on our social media site. So thank you both for being in here. Dan Brekke, Brian Watt, I appreciate your time and insight.
You're welcome.
Thanks for having us.
Zuckerberg San Francisco General Hospital is part of our social fabric, and for many, it's a safety net. The hospital sees about 100,000 patients each year. Many of them are facing food insecurity and housing insecurity on top of their health concerns. The hospital is also the only level 1 trauma center in the area, so people with gunshot wounds or who have been in serious car crashes are rushed to their emergency room. We spoke with an emergency room doctor about the population he sees every day.
2/3 of our patients are Medicaid beneficiaries, meaning they are on government insurance. Many of our patients are facing tremendous challenges related to homelessness, mental illness, substance use disorders, food insecurity. They may not be able to afford their medicine. They may not have a place to sleep to keep their leg up to get over their infection. And so we are able to do things again, like ask patients what is the most important thing that we can help you with today. Our programs are able to help provide medications sort of free to our patients, help work with our housing partners to set up a place where it would be safe for them to get over their acute medical illness as well.
The hospital is now celebrating 150 years. Joining us to discuss the hospital's legacy and its ongoing innovations are Dr. Susan Ehrlich, the CEO of Zuckerberg San Francisco General Hospital, and Kim Meredith, the CEO of the hospital's foundation. Thank you both for being here today.
Thank you for having us.
So, Dr. Ehrlich, let's start with you. There has been a recent surge of patients that you've seen unexpectedly. Tell us what you're witnessing.
Well, that's right, Priya. Today in the hospital, our medical surgical unit and our intensive care unit are both at 120% of capacity, which is really a lot and more than we'd like to be operating at. And some of the reasons we understand, so for example, we have COVID patients in the hospital right now. We have flu patients in the hospital, RSV. It's also the winter time when we typically see higher volumes. But the volumes are higher than we've noticed in past years. And there are other reasons that are not perfectly explained. One idea is that patients really put off a lot of their health care during the pandemic. And so now they may be experiencing illnesses that they wouldn't have otherwise experienced, like heart attacks and strokes. It doesn't matter what comes to us. We see everybody who comes to us, and that's one of the things that has made us so special for 150 years.
But it is a lot that you're managing, and for your doctors
Absolutely.
to be managing as well.
Yes, all of our staff.
Yeah.
Yes.
Kim, we see some of the work of the hospital's foundation, which raises money for the hospital. We see it throughout the city, most prominently, I think, in the heart statues that we see scattered around San Francisco. Tell us about those hearts and the work of the foundation more broadly.
Absolutely. Thank you, Priya. So our mission at the San Francisco General Hospital Foundation is to fund and support patient care and innovation at ZSFG. And so when we're doing that with our health equity lens, we are thinking about how we serve the hospital in every way. Our priorities are to fund its trauma care, to fund its mental and behavioral health needs, healthy families, and of course wellness. So in order to do all of that, we raise funds, and over the past 30 years, we have raised about $245 million for the hospital, and our goal is to raise that or more in the next 5 years. And one of the key elements of that is our Hearts in SF event, and we'll be having that annual event this year at City Hall on February 9th, and we will be auctioning off those hearts. So the hearts really launched the event back in 2004, and that event over the years has raised about $34 million for the hospital. And this year we have both our 2023 series and we have a 150th anniversary commemorative series. So we are very excited, and Ciaran Norris, our local Mission District artist, has done the commissioned 150th anniversary heart.
Tell us a little bit about how this money is used then, Dr. Ehrlich, within the hospital.
We use it in so many different ways. As Kim mentioned, the foundation has raised so many millions of dollars for us over the years, and it's gone into a number of things. It's gone into programs. So for example, it's gone into programs that we have for mental and behavioral health. It's gone into innovations and equity grants. It's gone into capital improvements and furniture, fixtures, and equipment. You think of it, and the foundation has raised money for us. Well, we're so grateful.
The hospital is celebrating 150 years. I mean, some of those buildings, you know, maybe not 150 years old, but pretty old. Tell us about the origin story of the hospital and how it's grown over the years.
Yes. The oldest buildings on campus now were built in 1915. And the newest building we have on campus, our beautiful new acute care tower, was opened in 2016. And so we literally have 100 years of buildings on campus. Right now, the focus of improvement is on our building that was built and opened in 1972. So that building is quite old. It is not it's not suited for modern day outpatient care, which is what we mainly do in that building. So we have all kinds of improvement opportunities on campus.
The hospital does have an official name, Zuckerberg San Francisco General Hospital, named after Meta's Mark Zuckerberg. Mark Benioff, Salesforce leader, has a hospital in Oakland bearing his name as well. Kim, what do you think about this practice of naming public institutions after wealthy donors?
That is a great question, Priya. So realistically, society depends on private philanthropy to do so much. It's strategic risk capital, for example, at the hospital. It funds those equity and innovation grants that over the years have created new programs, social medicine, the addiction care team, Solid Start. So the reality is society does depend on philanthropy. What we do at the San Francisco General Hospital Foundation is we have a gift acceptance committee, and we assess who is giving that gift and what type of gift that is and the complexities, if it's property or if it's cash. But importantly, we do believe in public-private partnership, and I think in the case of Dr. Priscilla Chan and her husband Mark Zuckerberg, she went to UCSF Medical School. She was a resident at Zuckerberg San Francisco General Hospital and is a child of an immigrant and has literally dedicated her life to health equity. She's a philanthropist, she is a teacher, and she is a physician.
The hospital has about a $1 billion budget, and you do get money from lots of different places. It's not just private donors. You recently got some money from a community fund that is overseen by Congressmember Nancy Pelosi. And I know you also took care of Nancy Pelosi's husband, Paul Pelosi, after he was attacked by an intruder in his home in October. He went to your trauma center, which is the only level 1 trauma center in the area. Tell us about that care.
Well, we are privileged to take care of everyone in the community. It doesn't matter if you're Paul Pelosi or if you're somebody who's experiencing homelessness and less privileged. We care for everyone. And we do so with an equity lens and a patient-focused lens. So no matter who you are and what you're coming to us with, we want to understand what that is and provide the care that you need. And we are so fortunate to have such a talented group of staff, physicians, all kinds of people who make up the care team at our hospital. And they are not only providing expert and compassionate care, but they're thinking about how to improve it all the time. So we are there for you in San Francisco.
Tell me about the innovation part of the work that you do there, because that is really important and critical for care not just now, but what is to come. So Kim, why don't we start with you?
Absolutely. So for me, that innovation piece is key. When we think about our Equity and Innovation Fund, that is strategic capital, strategic philanthropic capital, where Susan and her team can try new ideas. And when you put that into context of who the hospital is serving, 20% of San Franciscans all the time, and up to 30% during the COVID pandemic, it's really critical that as a public hospital, that it is innovating continuously and learning as it goes through the process. So we have funded the social medicine, we've funded the addiction care team, we've funded a lavender room for sensory needs in the psychiatric department. So really finding ways to support that and to support the leadership development at the hospital so that Zuckerberg San Francisco General Hospital can continue to be the leading public hospital in this country, and I believe it is.
I recently took a tour at the hospital and learned a lot about your behavioral health work. Dr. Ehrlich, can you tell us about why that's so critical and how you provide that care for patients who are coming in?
A very large fraction of the patients we serve, both on the inpatient side, outpatient side, struggle with mental and behavioral health issues. And so because we are so patient-focused and because we're constantly seeking to improve the care we provide, we have a focus on that. So one example of that is the addiction care team that was funded very generously by the foundation and has proven to be very successful in not only helping patients while they're in the hospital, but in preventing readmissions to the hospital. That's just one of many examples. Our social medicine team in the emergency department, we have outpatient teams that take care of patients. It's really incredible what we do in that space.
Most of the focus over the last few years has been COVID, but as we know in San Francisco, there is also a major problem with fentanyl and drug overdoses. Dr. Ehrlich, tell us about how the hospital takes care of these patients on the receiving end and the work that you're doing with the city, potentially to plan for the future and to change these outcomes and patterns that we see right now.
We in San Francisco are extremely lucky to have a very active, involved Department of Public Health, of which Zuckerberg San Francisco General is a part. And there is a tremendous amount of work and activity that is going on to address the opiate overdose crisis at every level, on the street, in the Tenderloin, all over the city, in people's homes, at the hospital. We're a really critical part of that care delivery system. We provide care in the emergency department, in our psychiatric emergency department, and fortunately we just heard the numbers that were issued by the health department for the second year in a row. We've seen some decline in accidental opiate overdose deaths, and that has to be due to a lot of this very concerted effort that we in the Department of Public Health are doing.
It's good to see that, right? To hope that there is change on the horizon there.
Absolutely.
Kim, where do you see the hospital changing, evolving, growing over the next several years?
Well, there are so many opportunities to support the work at the hospital, but I would say probably our priorities at the foundation would be twofold. One, you just heard Susan talk about the needs related to mental and behavioral health, and we have our Transforming Mental and Behavioral Health Fund, And so we are continuing to raise funds for that work so that we can continue to find new ways to provide care, patient navigation, look at the data, what are the social determinants that we can affect at the hospital. So our Transforming Mental and Behavioral Health Fund. And then secondly, when you look at the beautiful new acute care hospital, and you look over to the outpatient care center, we really are trying to create a vision of outpatient care for the future, where we're integrating mental health into all aspects of primary care and creating the facilities in order to make that all happen.
All right. Kim Meredith, Dr. Susan Ehrlich, thank you both for being with us.
Thank you so much for having us.
Tonight's Something Beautiful features those hearts in San Francisco we just mentioned, which are placed throughout the city for all to enjoy. And that's the end of our show for tonight. Join us next week when we talk to Jeffrey Tumlin, the Director of Transportation for the SFMTA, about the future of transit in San Francisco. If you'd like to suggest questions, you can email us at knr@kqed.org or find KQED Newsroom online or on Twitter. You can always reach me on social media at Priya D. Clemens. Thank you for joining us. We will see you right back here next Friday night. Have a great weekend.